25 years ago, when the PSA test came out, it was thought to be really something that was going to help us to make the diagnosis of prostate cancer a lot easy, and that we could use it as a screening test. And we found a lot of prostate cancers. Most of them were fairly advanced, and they were fairly straightforward. But over the past 25 or so years, that whole situation has changed. And what we found now is that we're discovering a lot of prostate cancers that we wish we didn't know about by using the PSA test. So what's happening is we're finding that people who are 90 years old, 90% of them have prostate cancer. People that are 40 years old, 40% of them have prostate cancer. But the hooker is that only 2% of those people are going to die from their prostate cancer. So we're going to be identifying a lot of prostate cancers that are benign disease that we wish we never knew about because they're going to kill anybody. Then we've got a problem because we have to decide, are we going to treat these people? And a lot of people think, if I have cancer, I want that thing out. But the problem is that you're doing a lot of unnecessary surgeries and causing a lot of complications because the surgeries, the radiation, and the androgen deprivation therapies are not benign. They all have serious side effects. So what are we talking about when we say PSA? It means prostate-specific antigen. And what does that mean? It means that there's a protein in prostate tissue that is given off into the bloodstream at a pretty steady rate. The bigger the prostate, the higher the level of PSA. So what we're finding is that the real relationship is in the size of the prostate, not so much whether or not there's a cancer there. Because the statistics show this. 25% of people who have a PSA in the normal range are going to have prostate cancer. 50% of people who have an elevated PSA are not going to have prostate cancer. What good is the test doing us? It's making us all crazy, not knowing what to do with the tests that we have. Now, if you have prostate cancer and it's unequivocal and it's a serious disease, yeah, the PSA is going to tell you a lot. It'll tell you the height of the cancer activity and give you a good idea of whether or not your treatment is working. In that setting, it's still a good test. But for my patients, I don't recommend doing that test anymore as a screen. In fact, I'm not so sure doing a rectal exam is the right thing either, although I still do that on my patients. And the main reason for that is because that test is confusing as well. We wind up with too many biopsies, and too many people are finding out that they have cancer, but the cancer isn't one that needs to be treated. So, yes, the PSA test is around. It's going to be around for a while. But it's not the kind of test that we're going to have to bank on as the thing that we need to do that's the final answer to this question. Because let's face it, there are a lot of other reasons why PSAs go up too. You can have infection or trauma. You can have a problem with just a large prostate because of benign prostatic hypertrophy. The rectal exam itself will give you a high PSA level. There's nothing like not knowing that little fact, having your prostate exam done, then going the next day to get your blood test done and find out that you've got a sky-high PSA, and next thing you know is you have a biopsy, and then you find that cancer that 98% of the time you wish you didn't know about. So the PSA era is over. Thomas Stamey, the person who actually brought this technology forward back in the late 1980s, has said that himself. So we need to think twice about how we're going to evaluate people who we suspect might have prostate cancer. And at this particular point in time, there are no tests that are great. There are a few tests that can be used that if you search on the site you can read more about. Things like doing the MRI, the coil MRI with spectroscopy, or doing the 3D, 4D color Doppler that's done out of New York and Miami and a couple of other places now. These are some of the tests of the future, but at the moment they're not really cost effective. But there are things you can learn about it. The reading is there. I invite you to read about it so you'll know what to do in your situation.